Bismillahirrahmanirrahim. Assalamu alaikum. And today we are going to discuss important topics about counseling. One of the important topics that usually we ask in an exam, and it's also a part of your long case, that if you get a patient who underwent hysterectomy and she is going to discharge or going home, what advice you will give to her? So we are starting our first topic of counseling, that is post-hystrectomy patient. You can face different scenario in exam, like if you have a patient that is post-menopausal and her hysterectomy has been done, her counseling point can be different from the one that is a premenopausal woman. Like if a young patient who is 40 years old, 45 years old, she went under hysterectomy. She had a total abdominal hysterectomy with bilateral oophorectomy or without oophorectomy. That what advice you will give to her when she is going home? What is the follow-up plan for her? What either you will give her some hormone replacement therapy for her future to secure her future health or not, and in which patient you will consider these hormonal therapies. We will discuss all these points, inshallah, in today's counseling session. So, as per rule, if you are doing counseling at any station of any kind of patient, then you have to do introduce first yourself. Like I am Dr. ABC and I'm doing job over here, residency over here, and I have graduate training. And I want to ask few questions about your health and would like to give you some advice. Um, then you can ask from the patient, how are you feeling now? It's just to make his confidence, his or her confidence, and to make some rapport with the patient. It will build the patient's confidence on you, so she will start her story, telling about your health, etc. And then we can ask the patient what is your name, her age, and from where she belongs. Is there any acute problem that she is facing her? Any pain? Or if she has any pain, bleeding, cough, etc., whatever we people ask in our daily routine round as we see the patient. Then after this introduction, then you ask the patient, do you know what happened to you or what kind of surgery has been done on you? So according to the knowledge level of the patient, you have to deal with that. If she knows only that I have underwent surgery, but she has no knowledge about what is uterus, what is ovaries, and what is their functions, then first you have to give her some background idea about that your uterus has been removed and it is for benign reasons or for malignant reason, whatever the indication was, and your uterus along with the ovaries, and the ovaries either they are preserved or removed. You have to tell them after checking that from the procedure note, are already you will be told in the exam that the patient has underwent total abdominal hysterectomy with bilateral oophorectomy. Okay. Next, you have to give advice about the wound care. Advice are that you have to keep the wound clean and dry. She should wash her hand, and the one who is cleaning the wound for her should have washed their hands and use sterilized gloves. They should look for the signs of infection like redness, swelling, or any discharge from the wound. And there is no need to clean the wound each time with a pyodine. If they rub it very roughly, then it can disrupt the granulation tissue that is formed for healing of the wound. So if there is no discharge, no pus, and no blood coming out of the wound, there is no need to rub it with pyodine. Just keep it clean and dry. And then again advise her, I will emphasize on that she should take a bath when she go home. and then afterward dry it with the tissue paper or gauze, and then have a clean dressing on that. Okay, there is no harm from getting a bath after surgery when she go home after discharge. Give advice to the patient about diet and hydrations, as there are certain myths also that the patient avoids certain kinds of foods. Okay, and ask the patient to eat small, frequent meals that are rich in fibers to prevent constipation. She can eat all kind of fruits. There is no harm in eating oranges in the orange seasons and banana in banana seasons, as there are certain myths that they can cause their sore throat or chest infection, so they avoid it. As we all know that vitamin C is helpful for wound healing. And ask them to take a lot of water. It will keep them hydrated, prevent deep vein thrombosis. Okay, and also ask them to take the food that are rich in iron. It will keep their hemoglobin level at normal if they are facing any blood loss issues after surgery. Counsel the patient that you may feel tired and emotional after surgery and can have some pain and discomfort, but it will improve with time. Advise her to avoid heavy weight lifting for a few weeks, at least 6 weeks after surgery, and have plenty of rest. If she is a working lady, then she can have medical leave from her job also. In the physical activity, you can emphasize on that you can have a gentle walk after a few days, gentle walk for a few days after surgery. It will improve your circulation and also will prevent clot formation over large veins that can cause many problems if it dislodges, but they have to avoid the strenuous exercises and the physical contact with their partner and at least till 6 weeks. So the important point that many of the students miss during exam is that if her ovaries has been removed and she is premenopausal, like her menopause average age is we take around 51 years. If she is before that, then you have to give her hormone replacement therapy for at least 2 years so that her menopause symptoms can be postponed. If her ovaries are intact, then you have to make sure at the time of discharge that you advise her that your ovaries are in place. But still, if she faces any issues like hot flushes, then she may and mood swing, then she may need hormone replacement therapy after few years. Okay, but if her ovaries are removed and her ovaries are intact and the uterus was removed for any benign reasons like fibroid, then you have to advise her hormone replacement therapy after few weeks of surgery, not just right now. Like if she's going home, then I advise her. You can call her after 6 weeks or after at the time for the stitches removal, then you can advise her hormone replacement therapy. First, you have to exclude all the contraindications for hormone replacement therapy, then you can advise her. So finally, at the end, ask the patient that you have a major surgery, so it will take some time. You might feel pain, discomfort at some time, and feel low and anxious. Then don't hesitate to talk about your problems. Talk to someone that is close to you, or visit your physicians or a counselor, so that your psychological burden can be shared. And advise her to take all the medications that are prescribed at the time of discharge, including the antibiotics, painkillers, iron, calcium, etc. And give her a time when to return, means like when to come for follow-up. One is we call use the patient for follow-up if we have applied some removable sutures on the skin. We advise them to you have to come at 10th post-op day for stitch removal, And you can also advise her that that when you collect your biopsy report, then you should come to the hospital and consult with your treating physician and show your biopsy report to them. This point is very important as many of the patient, when they get rid of the symptoms, like if the patient is facing heavy menstrual bleeding, they had a mass abdomen and it is removed and they get relieved, then they don't care about their biopsy reports. So it is very important to tell them that when you collect your biopsy report, or when the lab has given you the time that after 2 weeks or 3 weeks you have to collect your biopsy report, collect it in time and show to your treating physician, so that if the treatment needed can be timely intervened. And of course, say thanks to the patient at the end, and invite any questions, like if you have any queries about your problem, and if you